Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi, we're back for another episode of Smile Sisters, and we're going to talk about implants and specifically the steps for implant surgeries today.
Yes. So a lot of people are afraid to get implants. They think it's like a big surgery, and it is a surgery, but it's not as big as you would think. Like when people ask me, it's gonna hurt, my answer is, it's gonna hurt less than when you had the tooth taken out. So having a tooth taken out is actually probably has more healing time required than having an implant placed.
Yeah.
So it's not as bad as you would think, but yes, it's still a surgery. I don't want to minimize that there's still surgery involved.
But the bone actually doesn't have nerve endings, so when you're placing an implant, you're just numbing the gum tissue.
Yes, so
right?
The bone actually has no nerves in it. It has blood vessels, but we're numbing just minimally and then just reflecting the gum tissue away from the bone. And now when we're working in the bone, what you're going to feel mostly is like a vibration or just pressure. It's not very painful, really, as we're placing the implant. I would say it's more like a pressure sensation than like a pain sensation.
Sure. Versus an extraction, you're actually having to really numb that tooth because that tooth has nerves in it. Right? And it's more traumatic because you're literally trying to separate that from the tissue that it's sitting against.
Yeah.
With an implant, you're making a very controlled little hole in bone that doesn't have nerves in it.
Yeah, so let's talk about how an implant is placed. So
sure.
let's just start with a situation where someone has had their teeth taken out a few months ago, and now it's healed and there's nice bone in there. So when we're placing an implant, we're really pre-measuring like how long, and we've talked about this in other episodes, where the sinus is, where the nerves are.
Sure.
So we're placing the implant away from all these structures like sinuses and nerves and things. So we're measuring where we're going to place it. We do a CT scan, and a CT scan I think is really important when placing implants. So it's a three-dimensional view of your jaw. We're going to be able to see the nerve canal and the lower arch, and we're going to see your sinuses. So when we're placing it, we know exactly where these structures are so we can stay away from them, right?
Plus, you can actually see the thickness of the bone, where traditional x-ray comes in from the side here, and you're only seeing sort of the width of the bone, sort of front to back.
Right.
Versus when you're doing a 3D scan, like a CT scan, you can see the thickness of that bone, and that's important when you're placing your implants.
Very important. So there's even guides that we make. So based on the CT scan and a scan of your teeth, we make this guide, and the guide sits on your teeth, and there's a little tiny opening in this guide, and this one file fits into that opening perfectly. And based on that, we can really angle and place the implant exactly where we want it.
Right.
So it's pretty controlled situation compared to an extraction where there's no guide. You're opening the tooth up, it might be breaking. So if you've had an extraction, the implant process is much more controlled, and I want to say it's a smaller surgery.
It's much more civilized.
It is. It's very civilized. Okay, so we have the guide.
Yes.
We put the guide on. We numb the gums. We reflect the gums a little bit. And we go ahead and we make our first kind of hole. I want to call it a hole because that's literally what it is. So based on our pre-measurement, our guide and all this, we know, okay, we're going to make a hole that's 2 millimeters in diameter, and it's going to go 10 millimeters down into the bone, exactly in this spot at this angulation, because we know that that's the best place for all the nerve and sinus issues. Plus, it's going to be in the correct position for a tooth to go over it later, and it's going to match to the rest of your bite.
And we're using these drill bits, basically, that are exactly that size. So they're the first one is 2 millimeters wide, and then you're measuring 10 millimeters of that.
Right.
So you're using basically a drill bit, and
a tiny
one, yeah. and you're going and making this exact hole in the exact orientation 3-dimensionally into your bone.
Right. Now we've made the first, I guess, like entry into the bone.
Sure.
So far, pain level. Let's talk about pain level. So far, you've had an injection to numb your gums, and that's probably the most painful part so far.
Yes.
And when we're making the hole, again, if you are awake, or you can also opt to be sedated for these things, so then you really won't feel anything. But if you are awake, you have felt some vibration and some pressure, but it shouldn't have been painful in any way. And these are kind of like dentist words, vibration, pressure. Like, it's still uncomfortable. Okay, I'm not gonna lie. Like, it's annoying. Someone's drilling a hole into your jaw, but it's not painful in the sense of like a sharp pain.
It's not.
Yeah. So, I mean, if you are someone who just can't tolerate these things and who is like super nervous or very anxious.
It's more about anxiety. You can be sedated for anxiety, like if you are, like you said, nervous about it.
Yeah.
Versus the pain level will not be there. It'll be taken care of.
Yes.
But if just the whole process, the pressure, just having something in your mouth, having someone in there with drill bits in your mouth, all of that is not,
it's
fun
not,
for you
it's
then.
It's not fun. It's not. So yeah, you can be sedated too. So that's another thing. Okay, so now after we make the first kind of initial hole, I'll just call them holes because that's what they are. Then what we do is we go through a series of these drill bits. So let's say we want to have our final implant be 4 millimeters in diameter.
Sure.
Well, we started with the initial hole being 2. Well, we might have like 2 other drill bits in between that is like, one is like 2.8 and one is like 3.2.
Sure.
So we're slowly expanding this hole. And we don't want to make it bigger than our final implant size, right? We want to make it a little bit smaller than where the final implant's going to be. And that's really important because now we're placing the implant into an opening that's smaller than it is. And that creates that nice tightness and makes the implant very stable.
Because your bone has a little flex and it'll compress. And it depends on where in your mouth it is. Certain areas of your mouth have more kind of spongy bone, like in your upper jaw. So then you make the hole smaller because you know the bone's going to compress more. You don't want this implant to be loose in there, and you might make a slightly larger hole on the bottom jaw.
Yes.
Like that.
So based on the density of the bone, we can kind of like make the final hole before we place the implant smaller or bigger. Usually in the upper jaw, we tend to go smaller because, like as he was saying, that bone is more spongy, so it has more give. So as we're placing the implant, we're able to put pressure on that and like tighten the bone around the implant.
Yeah.
After, we make our final opening, we place the implant. This is where I think people have the most pressure sensation, is when we're placing the implant. So sometimes what we do is we kind of tighten it a little bit and we wait. We let that bone kind of like adjust to it, and it takes about 3 minutes. So we'll tighten it, wait about 3 minutes, tighten it, wait about 3 minutes. So it's just like slowly instead of really just tightening it all the way.
Right. So we're screwing this implant, which is like a screw, into this pre-drilled hole that is slightly smaller than the diameter of the implant.
So I mean, anybody who's done like any kind of like building carpentry totally, you can basically put a screw that's bigger into a smaller hole in certain woods, and depends on the wood and the gift. So it's like the exact same thing, but in like a miniature version of
it. Exactly. Yeah.
So we take our time, we slowly tighten it. And once we have it in place where we want it, and again, we've pre-measured all this, we have a guide, so we know exactly where we want it, how we want it. Perfect. Now we put what's called a cover screw over it. And this is just a screw that goes on top of your implant, just so the gum doesn't grow into the implant.
Into the little hole where the implant was like... Because basically we have these drills, and then the drill bits are attached to them, or the implant is attached to it. So then you can like slowly screw it in. So you just cover up that little hole.
And then you suture the gums back over it.
Yes.
Now, this is it. This is the whole process of placing an implant. So it's not like rocket science. It's just mainly about managing where to place it and how deep and how, which size. And that really has to do with the planning.
Yes.
So more than the actual surgical moment. So
right.
if you have, a CT scan and a 3D scan of your arch, you can pre-place these things. And then it's like a super smooth process.
And the placement of it matters because this has to be harmonious with your other teeth.
That's
so you
right.
have a space between two teeth, let's say that you're missing a tooth and you want an implant.
Yeah.
You want to place this implant kind of in the middle and make sure that there's enough gum tissue and bone on either side. And then when you get a crown on this, the contour will be right, so it's not like a food trap or bacteria
Exactly.
trap.
And it's not like a long crown or, all these issues.
In the front of your mouth,
It has
sure.
to do with planning. Planning really matters, and how you angulate it and where you place it. So all these things. But the process of placing it itself is not that big of a surgery.
No, it takes about an hour, hour and a half.
Yeah. I know. I think like this one patient said, I was expecting to be here 5 hours and I was here for 1 hour. Like, good.
Well, we're just making a few holes and screwing something into it. It doesn't take
for
long.
5 hours.
But like you said, it's the pre-planning that actually takes
That's
time
right.
and requires you to have the experience of a dentist that understands how is this gum going to heal over this? What
Yes.
is this going to look like if it's your front tooth in comparison to the gum line of the adjacent tooth? Like, where do you have to end this implant positioning wise, front, back, and angulation wise, so
That's
that when
right.
you get a crown, it emerges out of your gums in the same way as your own tooth
Yeah,
does.
the emergence really matters, and how natural it can look, especially for front teeth. You don't want to have like this one big front tooth that's different from the rest.
Sure.
So, yeah, that's it. That's the process of placing an implant. It's not that complicated, and it's actually very much smooth and pre-planned compared to other things that we do in dentistry, like taking teeth out. And you can be sedated for it, but I would say most people opt not to be sedated.
Yeah.
It's pretty easy to deal with if you're someone who's not too anxious about going to the dentist.
It is. It's actually one of the much less painful than an extraction, maybe even easier than a root canal,
Yes.
in the sense of the process is
time
kind of
and-
cleaner and maybe
it's
faster as
more
well.
controlled.
Yeah.
Afterwards, we do recommend antibiotics and pain medication, but it's not because you're going to have some crazy pain. We just give it to you because you might have some pain, and just ice it just like you would any other surgery.
It is surgery, right? So
Yeah.
the side effect, the negatives can always be, there's always a chance of infection. So
Yes.
antibiotics for that. And then anytime you have surgery, there is going to be swelling. So
Yes.
some pain meds
Some
or anti-inflammatory drugs are
So,
indicated.
I hope that was useful in explaining the process of placing an implant. It's really a very controlled and minimal surgery, whereas some people think that it's like a big surgery. But it doesn't have to be. It can be very controlled and very planned, and things can be very much like according to a certain plan that we follow.
Yes, and it's such a good option when you're missing a tooth.
Yes.
In general, better than getting like a fixed bridge where you have to cut into the other teeth and now involving teeth that maybe didn't need treatment. And then if they fail, you lose your bridge. So go and talk to your dentist about an implant as an option. Don't just dismiss it because, some relative had a bad experience, because most people have great experiences. The success rate of implants is in the 90-something percentile.
It's a very, very successful procedure that we do. It's more successful than almost anything else in dentistry, I want to say. So
if it's done well
Yeah.
and there's no infection, then it can heal well and do well for you for the rest of your life,
Yes.
really, the
Yeah.
implant, once it's placed and it's fused. So great option if you're missing teeth.
Yeah. Okay, check us out at LA Dental Clinic if you want to make a free virtual appointment with either of us, or come visit us here in LA.
Okay, bye.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.